Hello, my name is Ryan Harper, and today we're going to be speaking with Gary Smith and Keiana Corprew about kidney disease and its early warning signs. So let's take a look.
I'm Gary Smith.
And I'm Keiana Corprew. I'm a nurse here at Fresenius Medical Care.
Well, I'm Gary Smith, as I said, and I'm a dialysis patient. Been a dialysis patient about how many years now? 6 years? About 6 years. And I work, I do outreach ministry, and I'm on dialysis from 11 hours. I'm doing good.
And I'm Keiana. I'm a nurse. I've been a nurse for about 12 years now. Started out at Vita Medical Center, and now I'm working at Fresenius. Been doing home therapy for 5 years now, and I enjoy what I do and taking care of patients and making sure that they are well taken care of.
When I first got I went to a doctor's in Raleigh years ago, and they told me I had high blood pressure and that my kidneys were failing. And as years went on and progressed it. And I came to a doctor one day, and she said, "You were at stage 3." And I was like, wow. And they said, you're going to have to be on dialysis soon. And when you get to stage 5. So they took me out of work and brought me over to this clinic here. And I started doing dialysis with the needles.
And he did in-center dialysis 3 times a week.
Yes, that's why I went to Dallas 3 times a week, Mondays, Wednesdays, and Fridays. We did that for a while. And then I forgot the doctor's name. One of the doctors came over and introduced me about peritoneal, and he told me about it. And I don't like needles, so I was like, okay, we'll try that. And they said I would be a good candidate. And we tried it. And I like it. I really do. It's a lot. It's okay. I like it. And I do it at home.
So the first steps we usually do is sometimes the doctors will come to us before they even reach dialysis. So they could be in CKD, and there are different stages to that, 1 through 5. And so the doctors will say, hey, this patient is getting closer to needing dialysis. Can you go out and do a home assessment to see if they're able to do dialysis at home? And in that process, I usually go out and talk to the patients about home dialysis and try to see, get a feel of what they already know about home dialysis, because we offer 2 different treatment options. Mr. Gary does peritoneal dialysis, but we also offer home hemodialysis. And so I talk to them about each modality. I try to talk to them about what to expect after being a home patient, like how often they're going to see the doctor, how often they're going to need lab work done, how often we'll be making those home visits, so that they kind of will know all the information to be able to make the best decision in what type of dialysis they do want to do. And then we also get patients like Mr. Gary from in-center, where sometimes the staff over there will say, hey, I think this patient will be a candidate, or the doctor, and we go talk to them and we do a home visit on them as well. So we can have one-on-one interaction with them. So dialysis in this process helps remove toxins, which are basically waste that we usually urinate out, and fluid that builds up that we usually urinate out. And so with dialysis, in his form, he's using what we call a dextrose solution, which is a sugar solution that helps get the fluid and the toxins out. Okay. So it can start out as little things like a patient may be feeling more tired and sluggish. As it progresses, they usually are very fatigued, having nausea, vomiting, maybe some shortness of breath because the kidneys are not working to their full capacity. So they're probably not urinating as much as they should. And so they're holding on to different toxins and they're holding on to fluid. And that's what usually may lead them to the hospital. And then they may find out, hey, I need dialysis if they're not being followed by a doctor prior.
Yeah. And for me, it was, I was short of breath, tired, because I was real energetic. I was real tired, getting tired. And my urine kind of changed, but it didn't do it until later on. And I didn't do the vomiting, but I felt bad, and that wasn't me. But today I feel good. Today I really feel good. Most days are good days, but I have some few bads. But most of my days are good days. When I first heard it, like most people, I was scared. All I thought about is I'm gonna die. I got a disease that ain't gonna be cured, and I'm gonna die. And I worked with a young man that was doing dialysis, had done dialysis, and he pulled me to the side and told me, man, it's just a part of living, man. You just got to do what it takes to stay alive. We all dying. And now I just look at it as something I have to do to stay alive, and it's a part of life. But I just want to prolong my life and doing what these ladies tell me to do on a daily basis, in which they do. They tell me what I need to do and how to do it, and I just do it. It's just a point of just getting up, going about my daily business, and just thinking about it as to live. I got to do this dialysis, and it just makes it a lot easier for me.
So our goal for our patients is always to try to get them on the transplant list. And we try to use this as a bridge to get them a kidney transplant. So Mr. Gary is on the kidney transplant list and hopefully at the top since he's been on the list for a while. Our goal while they're on it is to just try to make sure they have the knowledge that they need to do dialysis. For peritoneal dialysis, it is a every night type of dialysis. For home hemodialysis, it's 4 to 5 times a week, depending on your prescription. So we just try to keep the patients as uplifted as we can in order to get them to the other step, which is to be transplanted. Okay, so the doctor that he has works for ECU, Dr. Wafa Badwan, and she basically told us that this patient wanted to try home dialysis. And in that process is when I do the home visit. If the patient says, yes, I would like to start dialysis, we go through admissions to try to get the ball started. The doctor puts in a referral for a PD catheter. So they do have to have an outpatient surgery for it. And then we start training usually 4 weeks after the catheter is placed. So that will be the process and the steps that after the patient knows that this is what they would like to do.
I'm hoping that one day I'll get a kidney and I can get back to doing normal stuff or doing the hours of the day, because right now I'm on 11 hours a day, 7 days a week, 365 days a year. And I'll get a kidney, I can get back to doing full-time outreach ministry, helping people with food, clothes, and furniture and stuff of that nature, and fishing. And then I can just sit back and relax and enjoy life.
Great, that sounds good. But
Yeah.
thank you so much, y'all. I appreciate it, and I'm grateful that you spoke with me today to educate me on kidney disease.
Yes, and
Yes.
you do know the main risk factors for kidney disease, right?
I do not. What is it?
High blood pressure and diabetes.
Diabetes.
So yes, it is very important to go get your yearly checkups and make sure those numbers are followed. And if the doctor wants to put you on blood pressure medication, please take it so that it doesn't put you at risk for kidney failure.
Yes, please. I can't say it enough. If you have high blood pressure, please take your medicine. Look out for your blood pressure because I did not do that. And when I was told my blood pressure would make my kidneys bad, I kept on going. And this is what I have to go through. But you people out there don't have to do that. They don't have to go through what I'm going through. And I don't want anybody to go through that. But just take care of yourself.
Yes, I agree. Take care of yourself.
Take care of yourself.